Hey there! After 4 long years, I decided to embark on the final part of my Graves' disease journey. Undergoing surgery and finally removing my thyroid. It was bittersweet and a little scary, but I think this was the best decision for me, my health, and my life. So, this is it. There's no turning back. Time for a new beginning with more peace, balance, and joy. Alright, 7 days until I have my thyroidectomy, which basically means I'm getting my entire thyroid taken out. And I'll be on hormone replacement for the rest of my life. Woo! It's been a long 4 years of trying to see if I'll go into recession. That's not right. Whatever. But I decided to undertake surgery. It's one of the better options in my opinion, other than the iodine treatment. The other treatment would be I take radioactive iodine and I would have to go into hospital every day, and then I would have to like change my bed sheets and like not share any like common spaces with my partner. Just a lot of work. The surgery is just going to be a 2 to 3 hour surgery. I'll be in and out of the hospital the same day. A week from now, we're gonna say goodbye to my beautiful thyroid. Bless her heart and soul. 7 days specifically before the surgery, I'm going to have to take some of these drops. This is glucose solution, iodine glucose solution, and basically what it does is it helps my thyroid shrink a little bit so that up until the surgery, it's not as inflamed. It'll be easier for them to get out. It just limits the risks of like damaging important things in my throat. So here we go. Take 5 drops by mouth 3 times a day for 7 days. Use the dropper that comes with the bottle to measure the correct dose. To improve the taste, mix the dose in a full glass of water, milk, formula, or juice before taking. To decrease stomach upset, take this medication after meals or with food. Side effects: nausea, vomiting, stomachache, diarrhea, metallic taste in mouth, fever, headache, runny nose, sneezing, or acne may occur. Oh yeah, it's scary. Well, I'm glad I read that first, because I didn't prepare anything to eat. So let's make something to eat before I take the medication. I decided to film in the kitchen. Not the best lighting, but whatever. Let's go. The dropper, on one side, it gives us the milliliters, and on the other side, it gives us the drops. Alright, let's open this bad boy up. It kind of smells like water. I don't know how to describe it. But in like kind of a toxic way. Ugh, it's like dark. Oh god. Oh, it looks so unpleasant. In my head I thought it'd be clear. Oh god. Alright. Here it goes. Honestly, not that bad. So that is it. I have started this journey. Once I start this, I can't stop using it. So I have to be using this every day, 3 times a day, until my surgery, which is next week. My first ever surgery. I'm terrified. 7 days until my thyroidectomy. Whee! Okay. Today is the day. It's the last day I'll be taking methimazole, my glucose solution. Probably noticed I don't have any of my piercings. No more, all my ear piercings gone. My nose ring is gone. And I have retainers from my nipple piercings. I showered because you're supposed to shower before surgery. I hate it because my hair is super dry. I'm very nervous. While I was trying to go to bed, I definitely had like the biggest nerves. I know it's an easy procedure and I know that like I'm in good hands and XYZ, but it's really different when it's happening to you. I've never had surgery done before. It's scary. Here goes. Here's my final goodbye before I'm in the hospital waiting to be put into sleep for my surgery. I thank my thyroid for doing its job and the last 4 years being exhausted. Now my thyroid can take rest. Hopefully my body can also take some rest as well. No more glucose, no more methimazole. Now, off to surgery. Oh. This is 1 week from my surgery. Got in the hospital and I waited until I was called into another room, pre-admission, so it was just a lot of other doctors and nurses asking me the same questions. My name, my address, what surgery I'm in for. I got the IV in and then one of the nurses were like, okay, you ready? I'm expecting to be like put on a gurney and rolled into the surgery room. Nah, not for me, okay? I got up and I walked with this nurse and then we finally got into the surgery room and I just kind of like, I was like a deer in headlights. I had really good nurses who let me just like take a moment to just assess my area, and then I lie down and then the gas mask went on and then I woke up. Waking up in that bed though was really fine. I didn't feel like drowsy. I didn't feel like I was like saying silly things, and I got up around 4:26, I think. I took a few naps. Oh, and ice chips. When I got ice chips, and as I got an ice chip in me, I just felt like I was alive again. I had apple juice, and now I'm a big fan of apple juice now. So got out at 10, everything was fine. We taxied home. They clearly sprayed something here that was like for anesthesia or something. And it was easy to take off. It's not that big of a deal. And then like I had a bandage here, and then like I had like multiple like little sticky things, those electrocurrent things that they stick on you. Bandage from an IV. And yeah, tons of meds after that. I needed to take calcium pills, and I had obviously painkillers and my hormone replacement pills. So it was a lot of pills for the first like 5 days. Now I'm just on my hormone replacement, which has been pretty good. I'm still doing my neck exercises. Looking up is the hardest part. It's half of it's anxiety. And I'm hoping to be able to take up this strip next week. 1 week post-surgery. Woo! Okay, I am done with this. So I'm just gonna use this. Use some warm water. Mix it up. And then I folded up this, just paper towel. The sterilized strips are still, they don't want to come off. So, also I did my nails, gel nails. Did them all by myself. But yeah, so it's soaking. I'll let this rag sit on my neck, I guess. Wait. Just wait. And wait. Last night was a bust. This morning I took one of them off. There's 3 strips on my neck. I'm gonna try to take out the rest of the 2 strips. So, good luck to me. Are you ready?
Okay. Oh! Gentle and gentle. Oh, I got it off. Oh, I got it off. Got some warm water Q-tips. Ah! I think I see the incision. Will we do it? Will we get the whole bandage off? I'm ready! I think that's my incision. There you have it. That's insane. So it's off. I'm not gonna lie, there was a little bit of like my heart kind of skipped a beat when I started to see more and more of the scar. It's kind of sensitive to touch right now. So if you're watching this and you're contemplating on surgery, I'd say to do it. I waited 4 years. I know there's people who waited longer than 4 years, people who didn't wait at all. But from my experience, I definitely feel so much better. I'm grateful for it. It taught me a lot of things, to be resilient and to love myself in all states and forms. I also just feel more lightness to me. I don't feel so weighed down anymore. I don't feel as sad as I used to. I feel very calm and I feel very collected, relaxed. I feel like everything's very clear, like clearer than before. This is 2 weeks post-op. I want to thank all of the doctors, nurses, physicians, and any medical practitioner along the way who's helped me all the way from day one in that walk-in clinic to now, my surgeon, Dr. Madani, and his wonderful team. I really want to thank all doctors out there too, folks who are saving lives every day, whether it be just for someone like me who just needs to take their thyroid out, to heavier procedures that are life-threatening. It's easy to forget how fragile our lives are, and it's easy to forget how grateful it is to have people who dedicate their lives and their careers to helping other people. Just really glad it's gone. I'm really glad it's done, and I'm excited to see what the healing process is like. But from here on out, life's pretty good. I hope you stay hydrated, wear your SPF, do your doctor's appointment, get your checkups done. Don't hesitate to go to the doctors to figure out what's happening. It's always better late than never, but it's way better earlier than late. I know it's fearful to think about our mortality, but I think it's even sadder when we're not even able to. And remember, someone loves you out there. I just want you to make sure that you take care of yourself. Because life's a gift, and you gotta cherish it every day. Until next time, friends.